Good morning and welcome to the Thursday, August 13th COVID-19 briefing. I'm Megan Pearson, your Chief Communications Officer, and today I have with us our Chief Administrative Officer, Ryan Alsop, our Director of Public Health, Matt Constantine, and our Lead Epidemiologist, Kim Hernandez. Very quickly, I'm going to go through some information related to testing, and then Matt will come up. Currently, between all of the federal, state, and county sites that are funded here, we have completed 44,666 tests. At the federal surge site, we've completed 5,356 tests since it opened. That site will remain open until August 21st. I want to remind everybody that is a self-swab site, so it's less invasive than some of the others. So if you're worried about the affectionately named brain tickle test, the federal surge site is a really good option for you. They also have a pretty quick turnaround time, so if you're asymptomatic, that's also another good option because you may see a faster turnaround time there than in other locations. We've also tested through our mobile farm workers testing. We've completed 182 tests. We are also just now starting a pilot project in partnership with Cal OES and HHS, the federal team, to create a mobile testing site. It initially will be with large employers here in the county to test their employee base, but we're also having a couple of sites in the next couple weeks that will be open to the public. We believe on Sunday we will be at the Mercado Latino, and then in the following week we'll be in Fraser Park and Pine Mountain Club. We'll provide greater details about that as we get closer. It is a pretty exciting partnership and we look forward to what that could mean. And now I'll have our Director of Public Health come up, Matt Constantine.
Thank you, Megan. Good morning. This morning we are announcing 320 new COVID-19 cases in Kern County residents and unfortunately 4 deaths in Kern County residents. Previously we've spoken quite a bit about hospital staffing and the importance of ensuring that we have a healthy and available hospital system for anybody that does get ill. The county, as we've spoken about before, has contracted with a staffing company to provide up to 88 ICU nurses that can be then distributed to many of our local hospitals to help increase capacity, especially with ICU beds. That agreement has been in place. The staffing company has been obtaining and recruiting individuals, and we are now finally starting to see some of those ICU nurses from out of town come in. So Delano Hospital has received 1 ICU nurse. Kern Medical has also received 1. Kern Medical will also have 4 next Monday, and the following Monday we'll have 10 additional ICU nurses. So the system is working. It's just taking a little bit of time for us to recruit and ask these individuals to relocate to Kern County for a period of time. And as we've spoken also previously, the state has deployed a number of different teams, medical teams, to help in some of our hospitals at Kern Medical, at Adventist Delano and Bakersfield and Mercy and Memorial. There have been a number of medical staffing teams that the state has deployed. So we're grateful for that additional resource. And then finally, school waivers I wanted to speak briefly about. As you'll recall, the state issued school guidance about how schools could reopen. Under our current conditions, schools are required to do distance learning only. However, the state did provide a waiver option for elementary schools only. That waiver process allows a interested school to apply locally to Kern County Public Health for consideration. The state has identified a number of different criteria that must be met, some processes that need to be implemented and created, and then after Kern County Public Health reviews, we send it to the state for their final review. We've had more than 20 elementary schools express interest. We have received 2 completed applications that we are reviewing currently. We know there is interest beyond that, but that process is working, and we are working with these schools to explore this waiver option. With that, I'm going to ask Kim Hernandez to come up and talk about some data issues and CalReady in particular. So I'll turn it over to Kim.
Good morning, everyone. The first thing we wanted to mention and update everybody is the laboratory reporting issues that we talked about last week that were experienced throughout the state of California. We've heard word from the state that they have resolved most of those issues last weekend as they were fixing the disruption. We did receive about 1,000 cases over that weekend that had sort of backlogged in that electronic laboratory reporting system that weekend. Those have all been processed. We're continuing to move forward. For the most part, the state has told us that the disruption issues have been resolved. We're continuing to do our own local quality control as laboratories are reporting to us through both mechanisms so we can make sure that we are getting all of the results so that we can do all of the follow-up that is necessary in our community. Additionally, we wanted to let everyone know that we are working on some updates to our COVID-19 dashboard. There are a number of patients we have been unsuccessful in reaching after multiple attempts. At this point in time, it is unlikely that those patients are still ill, and many of them have likely been assessed by their personal healthcare provider. That there's no requirement for healthcare providers to communicate this information to us. They have fulfilled their obligation as a healthcare provider when they initially report the patient as positive. However, this leaves us at Public Health with an information gap, and this leaves many people in our isolated at home category when in fact they have already met the criteria to have the criteria for discontinuation of isolation. So in an effort to better to provide a better understanding of how many people may be infectious in our community, we're creating a new category on our dashboard, which should be available in the near future. The category will include people who are presumed to have recovered and presumed to have been released from isolation based on the time it has been since their specimen was collected that resulted in their positive test. We at Public Health have not had the opportunity to assess this particular patient, so we don't feel it's appropriate to include them in our existing recovered category. But based on the time of the test, the fact that they are not currently hospitalized or have died, it is highly likely that they meet the criteria for release from isolation and they no longer pose a risk to our community. This dashboard should be, this new category on our dashboard should be available soon, and we hope to provide continued better information for our community to assess the risk to the public. Thank you.
Good morning. I'm Ryan Alsop, the Chief Administrative Officer for the county. As of today, in our county, nearly 150,000 residents have been tested for COVID-19. Since the beginning of the pandemic, 24,499 residents have tested positive. 25,064, or 98% of those residents who've tested positive for COVID-19 have either fully recovered or are currently isolated and recovering at home, treating their symptoms on their own. Today, we're reporting 250 residents, or 0.9%. That's just under 1% of the total number of positive tests to date are receiving some form of care in an area hospital. Since the beginning of the spread of the virus in our community, we've unfortunately had 187 deaths, which represents 0.7%, or again, just under 1% of the total number of positive tests to date. A little bit of information on the Kern Recovers program. We're pleased to see that the City of Bakersfield has announced their plans to provide financial assistance to small businesses in the City of Bakersfield. Over the last 2 months, as we've reported, the county has infused $30 million into the local economy through our Kern Recovers program. This program has provided needed financial assistance to 938 small businesses throughout the county across 255 different industries. This additional assistance from the City of Bakersfield is needed and without a doubt will provide a meaningful additional support to our business community. So we'd like to thank the leadership of the Bakersfield City Council and certainly the leadership of their administration and City Manager Christian Clegg. Next Tuesday, August 18th, the Board of Supervisors will consider a recommendation for the county to allocate an additional $1 million in grant funding, specifically targeting the nonprofit community through our Kern Recovers program. Following the meeting next week, information on distribution of these funds will be available on kerncounty.com, and we'll be talking more about that as we go forward. But again, information on this program can be found at kerncounty.com. PPE distribution, personal protective equipment. We have 16 distribution points all across Kern County. Those small businesses who are interested in acquiring PPE at no cost to them, this is free equipment. You must fill out a simple application and schedule your pickup at the location nearest you. This information can be found at kerncounty.com. To date, the county has distributed PPE to 1,228 small businesses across 74 different industries, impacting nearly 22,000 employees of those businesses. Also on Tuesday of next week, the Board of Supervisors will consider a recommendation to build on this effort through an agreement with Community Action Partnership of Kern, or CAPK, who will provide needed distribution of PPE to the neediest among us, those who can't afford to purchase PPE or lack sufficient access to acquiring these products. This program will target specifically participants of WIC, participants of the food bank, and participants in youth and senior centers across Kern County. Again, this is a program that will be done with CAPK for distribution to those particular individuals, and we're excited about that. A couple of thoughts again on plasma. For those who've tested positive for COVID-19 in our community and have fully recovered, the county is calling on you to donate your plasma. For those who have been previously diagnosed with COVID-19 and recovered from the illness, your blood plasma, which is rich in antibodies, can be donated to help build up the immune system in someone who has a serious or life-threatening COVID-19 infection. There are thousands of you who will be reaching out to, will be calling you. If we haven't already, we will be in the days ahead. Please expect that phone call. We need your help. and you can save lives. Those who are interested now in finding out how you can donate your plasma, you can contact the Houchin Community Blood Bank. They have a COVID-19 convalescent plasma hotline. That hotline is area code 661-616-2575. Again, that's area code 661-616-2575. Lastly, a couple of comments, and in addition to all the work that the county is doing related to COVID, there are many different activities happening. Obviously, monitoring, tracing, contacting, data collection, testing, containment, all of those things. In addition, we have a workforce to manage, and we have to deal with workforce issues here in the county. We have around 8,000 employees of the county. We're the largest employer in Kern, and dealing with COVID is not just about standing up here and talking to the public about all the things that we're bringing to bear to deal with this pandemic, but it's also looking out for our employees. On Tuesday, the board will be considering a recommendation to provide our county workforce with additional and needed flexibilities to help our employees deal with the extraordinary challenge of their children being at home and not physically attending school. This is a plan targeted around the extraordinary challenge and burden of the distance learning position that we find ourselves in with our school districts, and not just with our school districts, but school districts all over up and down the state and throughout the country. This plan is going to allow our employees who have the ability to work from home to do so, to be present for their children while they are working from home, and for those who are not able to work from home in our workforce, and there are many, we'll be offering some child care expense reimbursement for those employees. This is a plan that we believe is important and provides some, again, needed flexibility for our parents who have particularly young children, not just high school children, but the young children who are challenged through this distance learning environment, making sure that they're getting the full benefit of the learning experience, and we're pleased to roll this out. I would say finally that businesses in our community who have employees, it's very important for you, not that you aren't doing it or not that you're not thinking about it, but it's very important for you to think about how your employees are going to operate through what we believe is going to be a very difficult environment related to their kids being home and distance learning. So I would call on all employers in the county to put great thought into providing flexibilities that your employees may need, provide the maximum amount of flexibility that you possibly can to allow for your employees who are parents, particularly if they are parents of young children, to give them the flexibilities that they need to ensure that this learning experience that we are undertaking and exercising now is done to the fullest and best that they possibly can do under very, very difficult circumstances. So with that, we're happy to answer any questions you might have today.
Thank you, Ryan. As usual, we'll go down the list that's been provided to you. Remember, it is *6 to unmute. We're going to ask each outlet to reserve just a first question when we call you, and then once we've made it through all the outlets, we'll come back and open it up for any follow-ups that weren't already covered. We do have reporters that need to get off the line onto other assignments, so this helps them out. So our first station is Channel 17. I believe we have Aton on the line.
Yes, that's correct. Good morning, everybody. Good morning, Megan. and Ryan and Matt. And so my question is for Matt, actually. You talked about that a number of staff are coming in to the hospital shortly. I believe you mentioned, ICU nurses. But besides nurses, are any other types of staff coming into the hospitals with this plan?
Eitan, I'm hearing from Matt that the answer to that question is no.
All righty. And I will come back later for more questions. Thanks, guys.
Thank you, Eitan. Our next outlet is Telemundo. I believe we have Jose on the line.
Hello, can you hear me?
We can.
It's Norma. Okay, it's Norma Gaspar. Good morning. And these are questions from our audience, from Telemundo. The flu season is, is approaching. Can people get both the flu and COVID-19? And are the symptoms going to be, pretty much the same as if you have one or the other? Should they expect to get more sick? Can they take longer to recover?
So we're going to have Kim respond to your question, Norma.
Good morning, Norma. That's a great question. The short answer is yes, the symptoms of flu and the symptoms of COVID-19 overlap in general, very across the board. A lot of them are very similar when you think about fever and a cough, as well as occasional patients who also present with diarrhea and other types of symptoms. We know that this is something that we need to prepare for as flu season is coming. It is still recommended that as soon as it's available, people receive their flu vaccine in order to avoid becoming severely ill with flu. This is something we're going to continue to work on and prepare for, locally as well as a state and a nation. And we do not know at this point whether being infected with one would put you at higher risk for the other. As you know, in the United States, when COVID was first detected, we were coming out of our flu season, so there isn't a lot of data at this point in time. There is an assumption that anytime your immune system is down, both flu and COVID-19 may be able to cause more severe symptoms because your immune system is already trying to fight something. And so that's why we've always encouraged people to continue to stay healthy, to keep their immune system well in order to fight any infections that they might come in contact with. So there's still a lot of unknowns, unfortunately, about the interaction between COVID-19 and influenza. We expect that we will see a lot of that occurring at the same time as we get into flu season. We want people to continue to prepare. We're hopeful that all of the things that we have been doing as an effective measure to reduce transmission of COVID-19 will also, on the other end, also help reduce transmission of flu. So there's still a lot to be learned and a lot for us to find out, but hopefully that answers some of the questions your viewers have had.
Okay, thank you so much. Come back with a question regarding the efforts to reach Hispanics, to donate plasma. But for now, that's it. Thank you.
Thank you, Norma. Our next outlet is KUZZ. I believe we have Rob on the line.
Hi, Megan. Yeah, it's Rob King from KUZZ.
Go ahead.
My question, yeah, can you hear me?
We can. Sorry, go ahead.
Okay, cool. My question is, what is the exact turnaround time for the surge testing site? I know we said it's shorter, but some private labs here have done it within a couple hours, and other ones have done it within a couple weeks. So what is the surge testing site? Can we get a more exact time?
So what we're being told is between 3 to 5 days. Some of that is attributed to the fact that we drive or someone drives the specimens down to Irvine at the end of the day. So it could possibly be a 2 to 4 day turnaround, but you account for a drive in there. We've also heard from individuals who have taken tests there that they had their results back in 48 hours. And we heard from one person that had them back in 4 days. So we've been shared, they've committed to us a 3 to 5 day turnaround. However, we're hearing that some are coming faster.
Okay, cool. Thank you.
You bet. Our next outlet is the Californian. I believe we have Sam on the line.
Yes, hello. My question is just about the number of cases that are being reported each day. It seems like they're going down. So I'm wondering if the surge that we were seeing over the last 2 weeks has sort of run its course, and if you guys have any idea what if we can expect the lower numbers to continue, or just what the expectations are for the future.
Thanks for the question, Sam. We'll have Matt respond.
Good morning, Sam. Yes, the numbers do seem to be lower the last few days. It is difficult to try to attribute those lower numbers to any one cause. Initially, around the beginning of July, we did see quite a high demand for testing at many of our community-sponsored testing sites. That demand has reverted back to kind of those earlier numbers, so it's subsided somewhat. And so therefore, some of our positives have subsided. With the lab delays initially, and then with the state's database having some struggles, even as of yesterday, it's really too hard for us to say if there is a cause for why the numbers have been lower. We need to look at this over a longer period of time and kind of watch what happens. Obviously, the state still tracks the 14-day case rates and the testing positivity over a period of time. So we're going to look at those that data over a longer period of time. So again, I don't have specific answers to try to draw a conclusion about the cause, but we are tracking it closely. Sam, does that answer your question?
Yes, thank you.
Okay, our next outlet is Kern Radio. I believe we have JR on the line.
Yes, good morning, Megan. My question is regard to the 20 elementary schools that have applied for reopening. With outbreaks we're seeing in other districts that have chosen to do that, does public health think that's a good idea, and do you support the 20 schools that have applied for reopening?
We'll have Matt respond.
Good morning, JR. So there have been 20 schools that have expressed interest over the last couple weeks. We have 2 complete applications that we are now reviewing. And you're right, we need to be cautious about how does this activity potentially impact the spread of the disease in light of some of the higher numbers we're seeing in the county. The state has, however, indicated that we can use regional or even local data from where the school is located or where the children reside as part of that evaluation process. So I think it is helpful that the schools present some very thorough, diligent plans to ensure that children are safe. Many of the areas of interest we have are from private schools where their enrollment is lower, they have more space, they have more ability and some more resources to achieve social distancing, to require face coverings. So if done correctly, with all of those issues addressed, cleaning high-touch surfaces routinely, finding ways to keep children apart, and to enforce those restrictions, I think if done carefully, it's possible. We are one component in that review process. After it goes through us, it goes to the California Department of Public Health for their final consideration. We don't know to what degree they will exert control. This is still new for us. So it's early on, but it is interesting to see that there are a number of schools that have expressed some interest, and we're going to work through this, and on an individual basis, school by school, we'll evaluate. JR, does that answer your question?
Yeah, just on a local, is that by zip code maybe? When we're talking about number of cases and zip codes, and the 2 that have applied, did you greenlight those? Did you send them off to the state for approval? Have you approved them?
So to answer your first question, yes. Surprisingly, the state has allowed us to use zip code level data, at least in verbal comments, in order for us to evaluate how the case rates are in those immediate areas they serve. And in your second part of your question, no, we have not yet approved nor submitted those two applications.
Thank you, Matt.
Thank you.
Our next outlet online is Channel 23. I believe we have Tori Cooper with us.
Good morning. Can you guys hear me?
We can, go ahead.
All right, so I just want to do some clarifying here. At the very beginning, Ms. Kim Hernandez was addressing the backlog issue that the state said was addressed. She was speaking very fast, and I heard her say 1,000 cases were backlogged. I was taking notes while she was speaking. I just want to confirm that that is the local impact here in Kern County. 1,000 cases here were impacted by this backlog and have since been fixed. I just want to clarify that.
We'll have Kim respond.
Hi, Tori. Good morning. I will try to speak slower. Sorry about that. What we got from the state electronic laboratory report disruption was last weekend when they had resolved most of that disruption. About 1,000 cases landed, in our piece of that. There were 1,000 Kern County residents. Those lab reports, there are 1,000 Kern County lab reports that had not yet been reported to us. Those have been resolved. This is a small piece out of, I believe the state mentioned, more than 300,000 electronic lab reports that did not come through during that period. So they worked through a lot of that. They gave us our piece of it, and those we received last weekend. Those have been addressed and assessed. They're on our dashboard. We've initiated contact with patients, and so we think that it's, we've been told that the vast majority of the issues they were seeing have been resolved, and the disruption of the laboratory reports coming to the public health department the disruption has been fixed, so we are getting them steadily now and more regularly. We're continuing to check between what we are receiving through the electronic laboratory system and what we are getting directly from the laboratories who are sending them to us directly to make sure there aren't any missing or any more issues going on. The state's still working through to make sure we're catching every last one of them to make sure that each county knows about the positive lab reports for their community. Did that answer your question, Tori?
Yeah, that definitely answered my question, but I imagine this question is going to be for you too, considering that the dashboard does break it down by age group. So over the weekend, a report came out that 100,000 kids tested positive in the last 2 weeks of July. So we're trying to see if you guys have the breakdown here in Kern County of the number of kids out of that 100,000.
I don't have them in front of me. That's something we can look up to see how many of those ended up being, Kern County residents, but we'd have to look for you.
Okay. I only had one more question. So yeah, the other one was about just getting, I know you guys had already mentioned how many people we've tested, and the surge testing site. I just want to make sure that I had that. You have to have numbers that have been done at the surge testing site.
You wanted the numbers from the surge testing site?
Yeah, how many tests have been done so far at the surge testing site?
5,356.
Thanks.
Mm-hmm.
All right.
Okay, our next outlet is Kern Soul. I believe we have Elizabeth on the line.
Hi, good morning. It's Elizabeth. My question today is about contact tracing. I know it wasn't talked too much about today, so I'm hoping someone can answer it. Michelle Corson earlier this week told me that public health has hired about 20 new staffers to help with contact tracing. So I was just wondering if public health feels like they're sufficiently staffed now to do contact tracing in a timely manner, or are they still feeling like they need that extra help with contact tracing?
Thanks for the question, Elizabeth. We'll have Kim respond.
Hi, Elizabeth. We continue to assess, how quickly we are getting through our cases and our ability to reach out to close contacts. And so this is something that ebbs and flows. As you know, we had a large surge earlier in July, and so we brought on a lot more staff to be able to deal with that. We're still sort of feeling out how many staff need to continue on their current job duties. It's almost every day you can ask any of the people I work with where we reassign tasks to see where the needs are. So we are feeling that we are receiving reports steadily now. We are reaching out to patients steadily. We're reaching out to contacts steadily. So that process is becoming a little bit more stable. And so, we never know when we're going to get another large group of them, or when we had that chunk that came from the state over the last weekend. And so we're constantly moving all of our staff around in order to be able to respond to the number of cases that we are receiving, and to get ahead of it by actually doing that contact tracing and having those people stay home so they don't create more cases. So the short answer is right now we continue to just assess how many people we have working on it and see which piece of the case investigation and contact tracing they're most needed at any given point in time. If we determine that there's a need for more staff, we'll continue to bring on more staff. Thanks.
Thank you, Kim.
Our next outlet is Valley Public Radio. I believe we have Carrie on the line.
Yes, hello, good morning.
Good morning.
Yes, my question for you today is about comorbidities. And so do you have you in the county been studying in depth the comorbidities of either those who come down with, who contract the virus, or those who are dying of it, so we know kind of on a national level some of these health risks that might make a more severe infection? Do we know what those are at the county level?
Carrie, we're going to have Kim respond.
Hi, Carrie. We are seeing very similar things as to what we see at a state and national level of a lot of the comorbidities that have already been mentioned, which from very early on with COVID-19 were part of the high-risk groups. We do see many people who are older in age. We do see people with particular underlying conditions. That's something we continue to assess in contact tracing, and one of the many questions we ask patients in order to determine if there is something that's missing in the body of information that everybody's using to inform who are the people at most risk. So we continue to ask those questions. We don't see many things, much that's different from what is also being reported at the state and national level. They're, of course, taking all of the information we're getting locally, aggregating it across the state and nation to see if anything else is coming up as a high risk. And they continue to assess that, to look further into it. So we're part of that piece. Locally, we don't see a lot of big differences.
So what does that mean then for what some of those underlying conditions are that you're seeing correlated with severe disease?
Hang on one second.
So some of the common underlying conditions that we see, outside of advanced age, which is one that we've known as a risk factor, is we do see significant underlying conditions. We see a number of people with obesity or diabetes or hypertension, unfortunately very common underlying conditions we see in our community. So those are ones that we partly expect to see, knowing that our community has high rates of those things already, but that they are also part of the equation of anything that could lower your immune system in a significant way, put you at higher risk of any type of infection and any type of a more severe illness. And so we continue to see those ones just sort of off the top of my head, but we know that there are other things that the state is looking into, in particular about whether people have a history of smoking or other chronic lung disease and things like that.
Okay, great. Thank you.
Thanks, Kim. Our next outlet is Channel 29. I believe we have Tim on the line.
Hi, guys. Yes, good morning. My question today is about what Ms. Kim Hernandez was talking about, the new classification we're going to have on the dashboard. How many of those folks do we estimate that cannot be reached at this time? Is it a huge number? Is it going to make a significant impact on our number of recovered, or is it more negligible? Just kind of so we have an idea of what that looks like.
Thanks, Tim. I think Kim is going to respond to your question. Give us just 1 second.
Sure, thank you.
Tim, we're doing some quick calculations. That's the holdup. Hang on 1 second.
Oh, yeah, sure. No worries.
Hi, Tim. We're continuing to go through and assess all of these cases, obviously. Part of our decision is determining, at what point have we exhausted all mechanisms to try to contact people, calling them by phone, sending them letters, giving them an opportunity to reach back out to us. So right now we do expect that there will be a proportion of them that are currently in our isolated at home category that are going to fall into our new category. And so it's probably going to be, 2%, 3% of those that we, when we're sort of said and done with it, we've attempted contact. With some of these patients, we make initial contact. We are able to follow up with them for a period of time. But when it comes time to fully, finish the assessment and say, yes, you meet the criteria for discontinuation of isolation, we lose contact with them. And so there's a lot of people sort of within the entire process that fall out at the end where we have unsuccessful contact, giving them that very last, hey, here's our last assessment. Yes, you meet criteria for discontinuation of isolation. Good luck, continue to follow up with your healthcare provider, and so that we actually put them on our recovered category. So in order to sort of help people understand what's going on in our community, we want to pull out some of those people who we've had some contact with, some we were not able to reach despite the efforts we've put forth, and the presumption that given the amount of time that has passed since then, those people are very likely to no longer be infectious. So you will see this, go back to some of the earlier cases that we've attempted to continue to contact over this time period. But, with the number of cases we have, at a certain point, it's no longer very helpful as a public health department for us to reach out to them because they're no longer a risk to the public because they aren't infectious. So we expect it'll be maybe 2 to 3% that are currently in that isolated at home category, but we'll have to kind of see as we continue to assess all of the patients that we are working with right now. Thanks.
Thank you.
Thanks, Kim. I'm going to go back to channel 17. Eitan, I believe you said you had some follow-up questions, and we'll just start making our way through.
Indeed. Thanks, Megan. The first question is for Ryan. Ryan, I was taking down the notes when you talked about the program that will be considered to help parents of who are county employees. Would you mind, if you wouldn't mind, just restating the program? I see offering child care reimbursement for employees, but what else will this program come with? I missed some of that in the notes. I apologize.
We'll have Ryan respond.
Hey, Eitan. It's fairly simple. I mean, we've been doing quite a bit of work managing through this with our workforce from the beginning. We provided some additional benefits and some flexibilities for when we were doing essential staff only right at the beginning of the pandemic spread in our community. We've transitioned from that a bit. This is really, again, focused on this challenge of distance learning in our community. We've got, thousands of employees who have children. We have employees who are single parents. We've got, there are a number of different challenges related to this distance learning and having your child at home and lacking the proper supervision. And so this is really meant to provide, it's not the panacea, an end-all be-all, but it is an effort to provide some additional flexibility for our employees to deal with this specific issue. It is rooted in providing those employees who have the ability, utilizing technology to work from home and to do their jobs from home, giving them the ability to do that, whether that is, 5 days a week or fewer, providing that flexibility, providing them with a stipend that will help, pay for some technology needs that they have in order to do their work from home. The idea, obviously, in having as many people working from home as we can is providing those parents with the opportunity to be home again with their children, where they'll have to balance their work with overseeing their 5, 6, 8, 10-year-old who is sitting at a table and looking at his teacher through a small screen. That's going to be a challenge for these kids going forward, and I think it's going to require a lot from our parents, being present. We have a lot of employees here at the county who do not have the ability to do that, to work from home. Their jobs are here or in other places outside the home, and in those cases, we are going to be providing some child care reimbursement for those parents to assist them in bringing in some child care. Obviously, this program will have an entire set of controls around it. These are some things that we've been doing for the past several months that we're just building on, but it's really, this effort is really focused on this distance learning challenge that not just our county employees will be facing, but all parents in this community will be facing who have young children that are dealing with this. Hope that answers your question.
Indeed. Thanks, Ryan. And my only other question, Megan, I believe is going to be for Matt, which is the following. There's still people reaching out to me asking about the latest case numbers released every day. I know you touched on the state resolving the glitch. Is there still a backlog in cases even now that the glitch is fixed?
We'll have Matt respond.
Good morning. So to answer your question specifically, we're not aware of any pending or outstanding lab reports that are being held up with the state's database. Although they've indicated they fixed it, it was not working properly even as of recently as yesterday, although today it does seem to be. So we're hopeful they've addressed the issues and found them. We're optimistic that has solved it. We were a little concerned about why it wasn't working properly yesterday, but we're not aware, but we're going to closely monitor it. So hopefully that answers your question.
Thank you very much.
Eitan, I just wanted to share that later today at 2 p.m. The agenda will be live and the details regarding the distance learning assistance plan will be on the agenda, so you can access that there. Okay, I think we also had JR say that he had additional questions. We can go there.
Yeah, thank you, Megan. The first one, can you name the two schools that have applied for reopening?
Yes, just 1 second.
Matt is going to look that up currently. Do you have another question that we can go to while he's going to find that data?
Yeah, it's also for him in regards to his comments this week on enforcement.
You
want me to go ahead and
All
ask, or
we'll
is he
have,
gonna
no,
be able to?
go, we'll have Matt come up.
Okay.
JR, good morning again. So the first one is Gideon Academy in Bakersfield. Hopefully I'm pronouncing that correctly. And the other one is Heritage Elementary School in Ridgecrest. They're both private elementary schools with enrollment of 25 students or less. So they're both very small schools. And did you have another question?
Yeah, thank you. You spoke this week about the lack of communication with the state in regards to enforcement. I was wondering, just as you guys didn't wait for the state to act in regards to the state nursing facilities, you guys kind of just stepped in at a local level. Why are we not doing that in regards to enforcement? And would you, as the Kern County Public Health Director, be willing to support or ask the Kern County supervisors or any of the city councils of cities in Kern County to pass an ordinance that would help you enforce these orders?
So JR, the communication with the state hasn't been perfect, and that's what we had been talking about. The coordination, I'm hoping, is going to improve. They have had 2 different state agencies reach out to us and attempt to coordinate efforts, but even as of today, that hasn't yet occurred. We know the state has interest in helping. They have established an email address that we can send the names of businesses or organizations that appear to be repeatedly not complying with the state order. And then to answer your second question, our job at Public Health is to do everything we can to protect the residents, and we are strongly advocating for following that state guidance. The governor and the California Department of Public Health have come out with some very specific recommendations and requirements, both. And we spend a lot of our day helping to interpret, because for our businesses that is confusing. They've come out with business sector related guidance, and not every business fits into that exact box. So how does it apply? How can we help our businesses stay open? So we spend a lot of our time advocating for that. And there have been, sometimes we get a number of complaints about businesses that are operating outside of what the state recommends or requires. We then have been talking to those businesses. We send out letters. If those letters are unsuccessful, and at times even phone calls, then we do refer them to the state, to the email address that they have provided. For the far majority of the county, I think we're doing well. People are heeding that advice, understand the importance, understand how those actions can impact hospitalizations and ICU beds. So I think the system as it stands now is working. I think there are some outliers, but I'm optimistic in the very near future the state will have a greater presence. They have regulatory oversight over many of these businesses, as they did, as you mentioned, with skilled nursing facilities. So we did jump on the skilled nursing facility issue, but we have not enforced state law on a local skilled nursing facility. We don't have that jurisdiction. But what we have done is to provide some resources, provide PPE, provide assistance on staffing, provide assistance on testing, so that they then do meet those state requirements. So, JR, hopefully that addresses your question.
Yeah, so you don't feel that this time that you need to come to the local leaders and ask for more power to enforce the ordinance?
No, I think currently that authority resides with the state. They have the ability to enforce those rules. They've developed this strike team for that sole purpose. So that, combined with our approach and our awareness, I think is sufficient.
Okay, thank you.
Thank you.
Are there any other outlets that have follow-up questions?
Yes.
Hi, this is Tim from Channel 29. I have a follow-up question, please.
Okay, I think I heard both you and Norma chime in.
Sorry. Norma, you can go ahead first if you'd like.
Okay, thank you so much. Okay,
You're welcome.
Okay, regarding the testing center at the fairgrounds, do you know, are you sure that the contractor, True North Provider, are they turning in results 2 to 5 days as they promised? That's one of my questions.
So we are hearing information anecdotally. I don't know that we can, with any lab, get proof of how long the results take to come back.
Okay, because that was one of the main points, in that center, that it was going to help provide results faster. So you don't know.
So I can tell you that we've had a number of our own staff tested there who are reporting results coming back in 24 to 48 hours, myself included. So just because we wanted to test the process, and so we've seen those results come back within the 3 to 5 days.
Okay, so how can we find out if the rest of the people are getting the same, the same service?
Norma, if you want to, we can connect you with Kim later, she can possibly dig into the information and find those numbers for you.
Okay, my second question is regarding the plasma donation, which is extremely important. What kind of outreach are you guys doing with the Hispanic population? Because it is true, with the Hispanic population, even donating blood, it's something that a lot of people are not used to, much less, donating plasma. So are there any specific efforts to reach the Hispanic community, especially those who do not understand or don't speak English, and try to convince them, about the importance of donating plasma? Most of the people infected with the virus are Hispanics, which in turn, means that most of the recovered people are Hispanics as well. They are the highest group that could donate plasma. So what kind of outreach in Spanish are you guys planning on doing, or what are you doing at the moment?
So Norma, I think on behalf of the county, we have a team that is actually reaching out to every recovered individual that we have information for, attempting to hit every possible individual. So it would cover those as well. It's very direct and targeted with their specific information because it is a very specific population, and we have the ability to contact them direct. There hasn't been necessarily targeted marketing approaches. We're really working just to contact them directly.
Okay, thank you.
And then I think we had Tim who had some follow-up questions. Just go back to him.
Hi, guys. Yeah. My question's actually about as the students start to go back to school, what about school immunizations? Is that still going to be strictly enforced despite the distance learning? Is a child not going to be able to begin distance learning if they're not up to immunizations? Obviously, I know it's a bit harder to enforce that. What's the kind of rule on that as we start this new academic year?
So Tim, there's a whole, that must be a very good question because that started a whole lot of conversation on the side. I think Kim is prepared to answer your question. Hang on one second.
Thank you.
Hi, Tim. The state has
Hi, guys.
specifically said that they are not waiving any of the requirements for school immunizations. Students still need to be up to date. We've actually heard at the health department of parents calling us asking where to get their child immunized because they weren't able to pick up their child's Chromebook because they weren't up to date on immunizations. So the state laws regarding school-aged immunizations have not changed. We encourage everyone to always be up to date on their immunizations, particularly since a lot of the vaccine preventable diseases that we're immunizing our school-age children against present similar to COVID-19. Many of them start with a fever and cough-like illness, and so if we can prevent that illness in those children, then we have less to worry about in assessing if they have those respiratory symptoms. So as far as we have heard from the state, children still need to be immunized, and we also have to think about, even if they are starting their school year off learning virtually, is at the point in time where they're able to come back on campus, we want them to be able to do so immediately. And we don't want to have to wait another 2 or 3 weeks for those children to get up to date before they can come back on campus. So we would encourage parents now to make the time to check their child's records, to make sure that they are up to date so they can stay as healthy as possible, as well as be prepared for that time when we get to be able to be back in person and learn in person. Thanks.
Thank you, Kim.
Okay, are there any others that have follow-up questions?
I do. This is
Megan.
Tori. Oh,
I think we had Tori jump in there first. Go ahead.
sorry. Okay, so I just want to be clear, just because you guys did address this, but I'm getting some other questions from my newsroom. So obviously the pie chart is growing in the unknown group. I have previously had a conversation with Matt, and how he was talking about how you guys were going to eventually hope to get back to that. But now there's going to be a new group, but that's for the people who are most likely recovered. So when will this be addressed, considering more than half of the population is unknown? When are you guys going to be able to start addressing that? And is that still related to the people? From what I understand, that was from incomplete reports. So are you guys going to now continue to be able to address that, considering there's more stabilization taking place within Kern County Public Health and some of this data?
Thanks for the question, Tori. Matt's going to respond.
Hi, Tori. Good morning. Yes, hi. Unfortunately, that unknown portion in the pie chart continues to grow. And that's concerning to us, but it does highlight truly what is the issue here, and that is the healthcare providers, the ones that are ordering the test, are not filling out that information on that form. So historically, and you and I think have spoken about this too, we've had time where we actually have employees that call up either the doctor that ordered the test or the individual and ask if they would declare their ethnicity on that form. Obviously, very time-consuming, but very important because we need to know who is this disease impacting the most, so that we can try to assist. So we are asking the providers to complete that information, at all times when possible. We understand that they're busy and stressed and they've got a lot on their plate. I don't yet have the time yet to go back and make those phone calls. We're hopeful that as we talk to more of the doctors and ask them to do that on the initial form, because they have the patient there, that would be the most efficient way. In the future, and I'm going to say when we have time, it might be if we have time, our intent is to go back and to figure out all of those so that we have a better understanding. We did initially have a pretty good small unknown category, but that was a testament to all the work that we had done. So it's still a priority for us. It's just there's other pressing priorities ahead of it, but it's on our list and we're going to try to get it done. Does that answer your question, Tori?
Yeah, I guess basically I'm always trying to take a peek inside what this looks like. So, when you're asking questions do you have a unit doing this? So do you have 3 people who are solely assigned to address this right now, or is there no one essentially assigned to this right now because it's not the number one priority that you guys are having to deal with? So I just want to understand if this has kind of been a back burner issue until other issues that are more pressing. I just want to make sure that that's what it is and that at this time there's not a unit assigned to this, because from hearing your response, it seems like, this is obviously an issue we care about, but there's more things we have to take care of. But I'm sitting and looking at this number, 13,928. And for me, if I had 13,928 unread emails, I would freak out. And that number is going to continue to grow with not even somebody even opening up a few of them. You know what I mean? So that's what I'm wondering, if there's a small unit, maybe trying to address the issue slowly so that the number doesn't get too far ahead of you guys, or if that's just something that you guys have considered to just keep on the back burner for now.
Right. And so Kim is giving me hand signals. She has 2 individuals that are working on this currently. But our number one priority is to make contact with those cases to try to give them information about how not to transmit the disease, to try to figure out who their contacts are so that we can give them advice. So this is something that remains important to us, and we're hopeful in the near future we will be able to send more resources to it, kind of readjust our staffing plan as that workload ebbs and flows, as Kim has talked about.
Okay,
Thanks.
yeah, I appreciate that. Thanks for the number.
And then we had someone else chime in there a minute ago. I didn't quite catch the name, but there was someone else that had a follow-up question.
Hi, Megan. It was Elizabeth. I just have one quick question. A couple of weeks ago at a press conference, Matt said that on average for every case, there were 4 contacts that need to be made. Is that still the case? Is 4 still the number, or has it gone down or gone up?
I'm getting information that it is still the same.
Okay, thank you so much.
Any other follow-up questions? Okay, we want to thank you for joining us today.
Hi, guys.
Oh,
I'm sorry, can I ask one quick question?
You sure can.
Council 29?
go ahead.
Sorry, apologies for that. You guys have addressed this in the past, but I just want to make sure it's still the case. Is it still not possible to get death data broken down by racial and ethnic identities? I know the state does it, but we here in the county have been more skeptical to release that. Is that still the case?
So Kim's going to respond to your question, Tim. Hang on one second.
Thank you.
Hi, Tim. As you've mentioned, we've discussed this in the past. We continue to explore different avenues. At this time, we are not able to release additional information on persons who have died related to COVID-19 other than the number of them. There is a little bit of information you can glean off the state databases that have published statewide. For example, at the skilled nursing facilities, they do have a number for skilled nursing facility residents who have died, but that's as much as we have the ability to release at this time.
Thank you, guys.
Okay, I think that was our last follow-up question. So again, we thank you for joining us today, and we will be back next week.